A well-functioning pelvic floor has the ability to contract fully and relax fully
Yes.
and to work with your body, work with your core, work with your diaphragm.
Welcome to the Mindset Mirror Connection podcast, the podcast where we debunk the eat less, move more, shrink more mentality and focus on what really matters, which includes your relationship with your body, food, self-worth, and the behaviors that align with all of those. I'm your host, Christina Hathaway, licensed therapist with specialized training in food and body obsession, certified personal trainer and nutrition coach. At the Mindset Mirror Connection podcast, we believe what you say in your mind, you see in the mirror. So let's have a conversation about that. Before we get into today's episode, I want to make sure you subscribe to this YouTube channel. Also, if you don't want to miss any content that's being dropped, make sure you hit that notification bell as well. I also want to know who are the people you want to hear from on this show and what topics would you like me to continue to cover. Thank you so much for your continued support. Now, let's get into the episode. What's up, guys? Welcome back to the Mindset Mirror Connection podcast. I'm so excited that you took this time to learn something new for your health. And today we are talking about pelvic health specifically in midlife. And I have a wonderful guest from across the pond. Her name is Chantal Lowry. Chantal is a pelvic health physiotherapist with over 15 years experience. She qualified with an honors degree in physiotherapy from the University of Witwatersrand in Johannesburg, South Africa, and has since worked across England and North Ireland. She has a special interest in women's health, particularly supporting women through peri and postmenopause, postnatal recovery, and complex floor conditions like prolapse, incontinence, and pelvic pain. Alongside her clinical work, she's helped women worldwide through her online pelvic floor masterclass. As a wife and mother of two, she combines her personal understanding with professional expertise, and women travel all over across the UK and Ireland to benefit from her holistic, compassionate approach to pelvic health. Chantal, welcome. Welcome to the Mindset Mirror Connection. Yes, I'm so excited to have you here. One of the main reasons I wanted to connect is because I feel like, and I know that this is a part of your specialty, is like working with women in pelvic floor health in like postpartum and different challenges that we find. But I feel like we don't talk about women in midlife and their pelvic health enough, so I'm excited to have this convo.
Brilliant.
Yes.
Brilliant.
So I need you to say the university you went to, because I really tripped over my words there. So for everyone listening, please tell us the university you went to.
It's the University of the Witwatersrand in South Africa.
Yes, I did not say it that way.
I know, it's a mouthful. It's okay. You can just go past that one.
That works. Thank you. I appreciate it. So let's just start here. I want to kind of know what attracted you to pelvic health specifically. Was this something that you had gone to university focused on, or did you fall into it? Just give us a little background on how you got here.
So in university, obviously studied normal physiotherapy. In South Africa, we cover quite a wide range of, specialities within physiotherapy. In my younger days, just straight out of uni, I was more interested in sport and all that sort of stuff. But obviously working with a lot of female patients, working with female athletes, I started to realize that there's a bit more going on than just the spine, the muscles, that sort of thing. And the topic of pelvic health really started to draw me in. Initially, more from a mechanical point of view, as in how it affects other muscles. But as I had babies myself, and obviously I'm now in my perimenopause years, it's become so much more interesting to me in terms of how midlife hormones, all those sort of stuff affect your pelvic floor and how that affects the rest of you.
Absolutely. I love that, because it's almost like you had this hands-on experience in recognizing that there was this area of physiotherapy that wasn't necessarily being focused on, and you are now an expert in that area, which is fantastic. I was thinking as you were speaking, because I've danced since I was 3 years old, and I think about some of these moves that we did, these like turns into splits into all this crazy stuff. And very early on in my life, I noticed some like urgency with having to go urinate. And I'm like, what's wrong with me? What's wrong with me? And not until now, until my 40s, am I realizing how much trauma I put on that part of my body on top of having a hysterectomy at 35. So I am interested, and I know this is going to be a kind of off topic from the start, but how does stuff like that affect you? You know, when you're a kid or an athlete and you put your body through these crazy different positions and in my case moves and dance, what does that do to the pelvic floor?
So if we kind of take aside the damage or the trauma to your hips, your lower back, all that sort of things, if we put that aside for a second, you'll find dancers, horse riders, gymnasts, all those sort of people tend to have really tight pelvic floors because they're using their core all the time, they're stabilizing all the time, they're constantly using those muscles. And they end up with what we call a hypertonic pelvic floor. And if your pelvic floor is really tight, that can have a few really detrimental effects on your health. One thing is the obvious pain. It can cause pain. The second, it puts extra pressure on your bladder. So you have increased urinary urgency, increased urinary frequency as you experienced yourself.
Wow. I'm so glad I asked that because honestly, I remember being in my 20s.
Yeah.
Like, why do I feel like, and my parents used to make fun of me. They would be like, you've got to run to the bathroom. And no one was like, this is a problem, you know? So I'm glad we covered that.
Funny, even something like that, you know, you talk about your parents saying you need to run to the bathroom. Do you know how many parents cause urinary frequency and urgency in kids by saying, oh, we're going to go in the car, go for a wee. Oh, have you been to the toilet?
Yeah.
Oh, let's do one just in case. And that starts those habits of emptying your bladder too much, which doesn't give your bladder the chance to actually fill up properly, stretch properly, and then empty properly again.
Oh my goodness. Okay. So I love that you said that because now what do? If I feel like I have to go, I'm going to go. I did that right before I went to the nail salon. And it was not a full bladder. So it's almost like you create this feedback loop filled with anxiety that if you're too full, that you're going to have that urgency. Interesting.
Yeah.
We should have a whole episode on that. So just bank that for later. But what everyone wants to talk about today is the topic of how our pelvic health changes, especially as we go into something like perimenopause and the menopause transition. So what do you find are the most common challenges during perimenopause, we'll say, and let's just start with maybe what's some of the first things that a woman might experience as her hormones are fluctuating and changing?
So there's the obvious or the more common ones, which is she might start to notice some incontinence, some urgency of urination, some frequency of urination. Some women notice they start getting thrush more often. Some women might notice they start getting more UTIs. But there's so much more than that. It's painful intercourse. It's bleeding during or after intercourse. It's some women find they have trouble with tight-fitting clothing. Some women find they can't sit in a pair of jeans because all of a sudden it's a bit more uncomfortable down there. And it goes as far as itching, burning. It all forms part of something called the genitourinary syndrome of the menopause. We no longer just talk about vaginal dryness. That's what everyone talks about for ages, is vaginal dryness. But it's actually such a big syndrome. And because women are so different, everyone, experiences that in a different way. And I think the big problem with that is because these symptoms vary so much and can seem a bit random, they don't necessarily make the connection to their hormones. If a woman's getting thrush all the time, she's like, oh, it must be the cleaning products, or it must be, my, soap, whatever I'm using, that must be what's causing this. Whereas in fact, it's nothing you're doing externally, most likely, it's your hormones. Yeah.
Wow. Yeah. Because I mean, I've explained on the podcast, especially with estrogen, we have so many estrogen receptors
Oh, yeah.
throughout
Everywhere.
our bodies, right?
Yeah.
And
Yeah.
as that begins to fluctuate, those
Mhm.
where those receptors live are going to have a different experience,
Yeah.
and it's very natural. But, when we were messaging back and forth, you had said something just about how women we don't have the medical system to
No.
even help support that. So you come in, I'm curious because what because we're not like kind of bringing it all together and understanding that it could most likely be hormones. What misdiagnoses do women tend to get when they're experiencing some of these symptoms?
Well, you get kind of the obvious ones. Woman has thrush, constantly gets anti-thrush medication.
Right.
Women have UTIs, they just see it as a UTI. And that's nearly a better case scenario. In worst case scenarios, these symptoms are minimized. These
Right.
symptoms are normalized. A woman in her 50s or 40s comes in and goes, "Oh, I'm having a bit of incontinence."
Mhm.
And you might get a, doctor that says, "Well, you're kind of that age now," or, you know, it's time
Something.
to use some incontinence pads. And that is just not the message women need to hear. Women put up with so much. And I think in a way, we're kind of trained to put up with a lot.
Mhm.
And I feel, especially in the last few years, I'm sure it's the same, on your side of the ocean, but over here, menopause, perimenopause has become a really hot topic. There's been a few good, TV programs, books that have come out, a lot of celebrities coming out, sharing their experiences. And it's really kind of allowed women to have a bit more of a voice and advocate for themselves and go, "No, hold on. I am 45. I'm having a bit of urinary leakage. This is not normal. What can I do?"
Right. No, I agree. And you had mentioned some celebrities discussing this, and
Yeah.
Halle Berry had
Yeah.
spoke about being diagnosed or the doctor thinking it was herpes
Right. Yeah.
because she was having
Yeah.
like itching and burning. She said, well, you
Yeah.
have herpes. And she's like, I've been with my partner for, unless something's happening that I don't know of, I don't
Yeah.
feel
This
like
could,
this.
this could have caused a real domestic at home.
Correct. And it's Halle Berry.
Yeah.
So if her
Yeah.
partner is trying to find someone else, I'm just going to have to tell them, like, that's probably not going to happen. I mean, it's Halle Berry,
Yeah.
but it's so common. And like
It
you
is.
said, for so many women, it is minimized. And even if we think about issues in puberty,
Yeah.
when we have women with terrible symptoms where they
Yeah.
couldn't in teenage years go to school or they were like completely fatigued, whatever that is. We just said that's a part of it. We've
Yeah.
been trained
We have.
to just be okay, that to not be
And ignore
okay.
it. Yeah.
You
Completely.
know, it's
Completely.
it's crazy. So I had touched on the estrogen receptors. Is there anything
Mm.
else like just for our audience to kind of understand the hormonal changes and how that directly impacts the pelvic
Yeah.
floor, if you could?
So it's the usual suspects when it comes to the pelvic floor. First of all, is your estrogen. So
Mhm.
when you have a reduction of estrogen, what you tend to find is a thinning of the tissues in the
Mhm.
pelvic area. You get a lack of blood flow to those tissues. They lose their elasticity. And then there's also a reduction in fluid secretion. So basically, the area becomes a bit more fragile, a bit more a bit less elastic. And just in terms of the fluid secretion side of things, that affects obviously your vagina's cleaning ability. Our
Mhm.
vagina is self-cleaning. It gives us a mucus that gets rid of anything that shouldn't be there. And the actual pH of our vagina is slightly acidic, again, to
Mhm.
protect against infections and all those side of things. And when estrogen goes down, it affects that. So that's why
Interesting.
we're more prone to thrush, to UTIs, that sort of thing. But then we also have our testosterone
Mm.
goes down at that stage. That affects our muscle mass. So
Mhm.
that affects your pelvic floor as well, as it is a group of muscles. So we get weaker pelvic floor. And of course, testosterone affects our libido.
Right.
So it affects our want to have intercourse. And then, of course, for the women who do push through, all the lack of estrogen has made everything so, thin and fragile that intercourse often hurts. And then that starts like a bad pattern in terms of sexual intercourse equals pain, equals apprehension, equals pain the next time, and can really negatively affect our relationships.
Absolutely.
And then we get progesterone, which affects your smooth muscle activity. So you have a smooth muscle around your bladder, you have smooth muscle in your digestive system. So that then affects our bladder function and our digestive function, which is enormously important for our pelvic floor function. Patients say I'm obsessed with bowel movements, and it is true because
Same.
people don't realize how important your bowel movements are for your health. Your pelvic floor in particular, if you're constipated, it leads to increased pressure on your pelvic organs, your pelvic floor. And also, if you're constipated, you tend to strain on the toilet, which again, pressure on the pelvic floor, which puts you at a much higher risk of incontinence and pelvic organ prolapse.
Wow. I have never heard it from all three. I've only heard it from estrogen. And I'm so glad that you added how progesterone and testosterone and the fluctuations in that, how it, physiologically changes pelvic floor, digestion, all of that. And it's so interesting. So as a therapist, I'm always thinking about exactly what you said. Okay, we have this natural occurring change in our bodies. Without maybe the education, we start having pain. Maybe we're not even, I've had so many women say, I don't even want to look at my partner. And I love my partner. And so I push through and it's painful and I can't orgasm or whatever it is. So then psychologically, I start to push away. I start to act differently, on top of the fact that my body might be changing, my moods might be changing. And it really creates such a very negative cycle from a like biocycle social approach, like our view, because biologically we have things changing. Like psychologically, it's affecting our moods. It's affecting our ability to connect. We connect through touch. And then, of course, it affects our relationships. And again, without knowledge, we just think, oh, the divorce rate here in the States, is 50, 60%. I haven't checked lately. This must be it. When it's like, no. There are many things we can do.
You look at how many people get divorced around the time of perimenopause, menopause. How many women leave the workforce at that time? And we don't, you get the lack of confidence, you get the fatigue, you get the, memory, cognition issues that happen at that stage in women who are in a low estrogen state. And you just think it's just not right that these women are not getting help, and not getting the help they need.
Yeah, no, I absolutely agree. And I think that's why we connected, because, the more that we can have these conversations, the more obviously women can advocate for themselves. And so I want to talk about, like, again, more. So we talked about some of the early signs. What I always hear things and I've debunked this since, but back in the day, we used to be like, do Kegels, do Kegels, do Kegels. It's the answer to everything, right? And I even, I'm not going to say who, but one of our very close podcasts, I'll say that, are men. And they did a program for women. It was a program for women specifically, and Kegels were in it. And this was within this year. And so when are they helpful, if ever, and when are they not enough?
So Kegels are really helpful kind of from the time you get pregnant, basically. Kegels are still, the research still shows us that Kegels are helpful in preventing incontinence and pelvic organ prolapse. Okay?
Okay.
Keep it. Oh, you'll see. I'll get back.
Got it. I got you.
And Kegels, or let's say pelvic health physiotherapy, is still the first line treatment for incontinence and pelvic organ prolapse.
Mm-hmm.
Problem is, I think there's a big misunderstanding about what Kegels are and how Kegels should work. Okay. I think women have this idea that I'm going to squeeze and squeeze and squeeze and squeeze, and it's all going to get better and everything's going to be great. If I just squeeze hard and long enough, it's all going to be great.
Right.
But people don't think or know about pelvic floor function.
Mm-hmm.
A well-functioning pelvic floor isn't a really strong, tight pelvic floor. A well-functioning pelvic floor has the ability to contract fully and relax fully,
Nice.
and to work with your body, work with your core, work with your diaphragm. So I would say, yes, Kegels are great if they're done correctly. And you're also relaxing the muscles and you're also focusing on using it with the rest of your body.
Mm-hmm.
Where Kegels become unhelpful is women, like you said yourself, with the dancing and all that, women who already have a tight pelvic floor, Kegels are going to make that even tighter, and it's going to lead to more problems. And then also, you have to think about the fact that problems like incontinence, pelvic organ prolapse, they are multifactorial problems.
Mm-hmm.
So yes, in the beginning stages, Kegels can be useful, but if we have a hormonal component, if we have a laxity component, those areas need to be addressed as well. So Kegels can be great, but they're not the answer to everything.
Right.
That
That's
answers
so
your
fascinating. Yes, absolutely. It's fascinating because, even myself, I know that I have a tight pelvic floor, but also I still turn to, I'm thinking about a influencer. Oh, I don't want to call her influencer. She's an educator, and her handle is Move Like a Mother with an A.
Mhm.
Have you seen her?
Okay. No, I haven't.
The way that she trains, and she's more like pregnancy and postpartum, but the way that she trains was so fascinating to me because it was a lot of like rotational work, of course, more of those like glute focused and
Yeah.
pelvic tilt type of
Yeah.
work. And I'm not going to lie, as you said that, I'm like, interesting. As I was doing some of her programming, I found myself, my symptoms getting worse. Not, and this, okay, this is nothing against her. I love what she does. I think it's
Yeah.
absolutely fabulous. But in my brain, I'm like, okay, I will follow her program and see how I feel. And I actually found myself getting worse. So
Yes.
with someone with a tight pelvic floor, what is the best approach for them?
So with someone with a tight pelvic floor, we want to focus on pelvic floor relaxation. And we do that through different exercises. First one, and the easiest one, is through deep diaphragmatic breathing. And your pelvic floor and your diaphragm is the same shape.
Right.
And ideally, they should always work together as one. So when you breathe in, your pelvic floor should expand slightly. And when you breathe out, your pelvic floor should come back in. And by practicing that type of breathing, and I always say to my patients, I want you to imagine you're breathing into your pelvic floor. Try and get that relaxation with the in-breath. So that's one. There's a few different type of breathing exercises you can do. The other one is pelvic floor stretches. So you get your happy baby, you get your child's pose, your sitting frog, all those sort of things to try and sit in that position for a while, take a few deep breaths, try to relax the pelvic floor. Another one I like is using like a little Pilates ball, actually sitting on the ball, taking deep breaths on the ball, gently rocking about on the ball to actually manually release and relax your pelvic floor. Now, there's other things that I'm not always a fan of. Like you get a pelvic floor wand that you actually insert vaginally to release your own pelvic floor. I'm a bit funny with that one. I think if you've been taught by a professional how to use it appropriately, it can be useful.
Mhm.
But if you just go ahead yourself and start digging, you can basically do more harm than good.
I'm sure. Yes, I've heard of the wand. No, that's really, really helpful because I I actually use a lot of diaphragmatic breathing in many
Uh-huh.
ways in my
Yeah.
own, training and when I'm working with
Mm.
clients. And for me, everything you said, like frogs, any sort
Mhm.
of, I even like to put the block underneath my hips and then do a little bit of
Mhm.
a happy baby to
Yeah.
just get it open.
Yeah.
So, okay, so we're on the right-ish track.
Yes.
We'll bring it back. I have another question because, so
Yeah.
many of my clients, especially in, 40s, 50s, who are strength training,
Yes.
I tend to, we tend to see more lower back injury. Is
Mhm.
that tied to, could that be tied together with a pelvic floor issue?
100%. Yeah.
Okay. How would that
100%.
be?
So if you think of what we consider your core to be,
Hmm.
we've got the diaphragm at the top, we've got your abdominal back and your muscles on the side. Your pelvic floor is the bottom of that structure.
Hmm.
So if your pelvic floor is weak, that structure is not stable.
Mm.
And then on the other side of that, you have the pelvic organ prolapse kind of thing, where your pelvic organs attach via a ligamentous attachment to your sacrum.
Hmm.
So if they're hanging down, if they're dragging down, that puts extra pressure on the lower back, especially if they're not getting the support from the muscles at the bottom.
Hmm.
Definitely
Wow.
strong relations there. And again, that can go the other way as well. If you have really tight pelvic floor, it can affect the way all that works as well. It's funny, all this comes down to you have to know what's wrong with you.
Right.
If you're symptomatic at all in terms of your pelvic region, don't try and figure it out yourself. See someone, speak to a pelvic health physiotherapist, speak to your general practitioner or, whoever you trust and
Mhm.
figure it out before you go on a rehabilitation plan or, try 10 various products online, basically.
Mine is like, oh, that
They're
looks
all
good.
guilty
I'll
of
try
that.
that.
Don't worry.
Well, I have a provider here where I live, and she and I
Hmm.
have partnered together. So I need to
Hmm.
go see her.
Yeah.
Um, let's, I love that. I mean, again, I'm learning so much, and I'm just thinking about so many clients who cannot find relief in any
Mhm.
sort of form changes we make, even
Yeah.
if we are reducing load, whatever that is. And that's because,
Mhm.
like you said, we're not focusing on the right area.
Yeah.
And
Yeah.
being able to now have that information and guide them to see
Hmm.
someone who will
Yeah.
help them and help them understand. Because again, you guys listening, it's not just weak versus tight. I guess it's weakness
Hmm.
either way, but there's differing things that could be happening
Yeah.
where we didn't know that. I didn't know that until, today. So I think that's amazing. Let's talk about lifestyle changes. So
Okay.
a lot of what I do is holistic, similar to you, where we're working on mental
Love that.
health and physical health,
Yeah.
right? We work on nutrition and
Hmm.
exercise. We work on
Hmm.
mindset. How does, changes in lifestyle, because in midlife we have, children with
Yeah.
schedules that are very demanding, parents that might be ill, we're very much deep in our careers, and that wonderful routine we might have had in our 20s and 30s is no
Hmm.
longer there for
No.
majority of women. And so we might see changes in exercise diet and of course changes in weight. How does
Hmm.
that interact with pelvic health, especially in the menopause transition?
Very important in terms of your whole body, really, but also specifically in terms of pelvic health. I mean, if we're generally healthier, it optimizes how our body can deal with these hormonal changes. So if we look at the exercise side of things, we want to maintain muscle mass, and that's throughout our body and throughout our pelvic floor. We want good bone density. So we want to be doing resistance training. Obviously, exercise is great for weight control, which does become an issue as you go through perimenopause. And the thing I talk about a lot with weight training in particular is a lot of women, when they have incontinence or prolapse, are told, don't lift heavy things. Don't do this. Don't do that. And that makes sense if you're a fragile, tiny little woman with no muscles. Well, then, of course, if you lift something heavy, you're going to brace, you're going to hold your breath, and it's going to be a lot of pressure on your pelvic floor, and it's not going to be great.
Right.
But if you have good, strong muscles and you go and lift that same object, it's not going to be that hard for you. Your body will be able to do that, and it's not going to put that same pressure on your pelvic floor. So I think it's fantastic for women to start training if they're not training already. Start at a place that's comfortable for you and build your way up. Your body is going to thank you for it, when it's 70, 80 years old. I think it's amazing. In terms of diet, again, I'm very pro-protein. In terms of diet, I want to maintain muscle mass as much as I can. Maintaining muscle mass, again, it's your metabolism, the weight, all that side of things. But also getting back to the bowel movements, Megan.
We love them here.
Good hydration and fiber. We want to be well hydrated. We want that fiber to help with the bowel movements. We want the fiber to help us metabolize all that extra estrogen that's being, pumped into the system as our hormones fluctuate. And when it comes to hydration, we can't not mention the whole alcohol thing.
Yep. Do it, girl.
Such a pity.
I know. I recently went on a soberish journey myself, so.
Yeah. Alcohol is unfortunately not your friend when it comes to perimenopause. Obviously, there's the dehydration side of things, but also, let's be realistic, alcohol is a toxin. Right. So your liver will prioritize breaking down the alcohol over anything else. So again, we go down the fat storage, kind of pathway, and also metabolizing those extra hormones that are being released.
Right.
But if it's focusing on the alcohol, it's not doing that.
Right.
And generally, getting back to the body weight side of things, maintaining a healthy body weight at that stage of life will minimize your intra-abdominal pressure, which will again minimize the pressure on your pelvic organs and your pelvic floor.
Interesting. That makes a lot of sense. Number one, thank you for validating everything I tell women on this podcast about strength training and, protein and having a healthy diet. I appreciate that. Something you just said stands out to me because as we've learned, visceral fat can increase throughout the transition, specifically postmenopausal. I never even thought about it, that visceral fat can also start to surround our pelvic organs as well, putting even more pressure
down
on them. Interesting.
Yeah. I mean, some of the factors that put you at risk for pelvic organ prolapse, we have the obvious ones. We have childbirth, we have hormones. The other big ones are an increased BMI and inactivity.
Interesting.
They're the two other factors that increase your risk of pelvic organ prolapse. So actually just being fit and healthy, all these things, we can't talk about exercise in isolation. We can't talk about diets in isolation. We can't talk about, they all interact with each other so much. And that's why, same as you said, how you run your business, taking an holistic approach to well-being and patient care is so important. If a patient comes into a musculoskeletal physio's, treatment room and they say, I've got a sore shoulder, it would be a really bad physio if they just looked at the shoulder.
Right.
You have to
Agreed.
Look at the person. And it's the same with this type of stuff. You can't look at the pelvic floor in isolation. You have to look at the person as a whole, their lifestyle, their diet, exercise, their mental well-being. All of that forms the picture.
Yes, absolutely. I am floored because I think a lot of women listening would not consider their digestion and how it affects their pelvic floor or any sort of symptoms that they're having. Again, just putting it all together and realizing it is, I mean, your body is so brilliant. It's so brilliant. And the way the systems all work together and or create feedback loops when one is not working the correct way. And I've always focused kind of diaphragm up, if you will, the mental health, nervous system. But more recently, I've done so much research on, how your endocrine system, your digestive systems, your nervous system and immune system, right? Like all of those really are it's all one big system. They're just
100%.
called different things and they all affect each other. And I'm so glad you said it like that, because in my mind, even as someone who I've read everything, I've never put that together, that all of those organs down there, you think pelvic floor is over here, right? This is over here, digestion's over here. It's not. It's all in that little space.
Together.
That is insane. And coming back to something you said about mental health, let's talk about stress. How does stress play a role in pelvic floor dysfunction during this life?
A big one. So obviously stress equals cortisol. Cortisol equals tension. And you have no idea how many women hold tension in their pelvic floor. Like, people know you hold tension in your shoulders when you're stressed. They know. So many women hold tension in their pelvic floor. And then, of course, that can lead to pain. That can lead to urinary symptoms like urgency, all that sort of stuff. But also, our bladder is actually very responsive to the nervous system. I have so many patients, and I'm in both ways, tight pelvic floor and, weak pelvic floor, whatever way they have, that tell me when they're stressed, their symptoms are worse. It has a massive impact on how our bladder functions. And then obviously chronic stress can suppress ovarian hormone release. So that just has an extra kind of hormonal component added to it and, makes our symptoms worse anyway. And then there are the behavioral links to stress. So women who are stressed are, again, more prone to constipation. Women who are stressed tend to hold their breath and brace, which is bad for your pelvic floor. Again, women who are stressed often tend to be depressed as well.
Right.
Those people avoid exercise, avoid social interaction, which again affects, the whole thing. So it touches on every single aspect of it. And the big one, I always think, and again, this is one of these ones that everything links to, is sleep. Hormones affect your sleep. Stress affects your sleep. All these things affect your sleep. And when you're not sleeping, as we all know, especially when we have little children, nothing works well. Nothing works well when you don't sleep, and everything feels 10 times worse.
Yeah, absolutely. I just did a whole episode on how to protect your sleep at all costs. Yeah. We didn't get into as much, postpartum. I think that's its own conversation for a lot of women, but just, it's so important. Yeah. And I'm thinking of myself, and I think a lot of listeners can realize when I'm nervous, when I speak in front of audiences, there's that, do I have to go to the restroom? This is hilarious that you're saying this, because yesterday I had a microneedling facial, right? And I'm on this journey to heal my skin. So I had this microneedling and I could feel I'm tense, and it's all in my pelvic floor. And I remember being like, relax, girl, you're just getting a facial. And they numbed my face. It's not like, I was just terrified because I had never had one before. I didn't know what to expect, or again, that idea of, I've got to lay down on this table for X amount of time. Do I need to go to the restroom? And the stress and the anxiety. And like we said in the beginning, I tend to do that. And now I'm not training my bladder that it can get, that it should be full before I go to the restroom. I'm slowly letting it out, and thus causing even more struggle and strain. You mentioned children, And I think for a lot of women think, well, I shouldn't say a lot. Women who have not had children might believe, well, I don't have pelvic floor issues. I didn't have kids. That's obviously so false from what you're saying today.
Yeah,
right?
No, completely. Yeah. I mean, yes, being pregnant and birthing a child does bring an extra dynamic to the challenges of pelvic floor health, but you're not protected from pelvic floor.
You're not immune to it.
No, you're definitely not immune to it. You still have all the hormonal issues going on. You still have, just general life. I actually find women who haven't had children tend to be they are more likely to have issues with pelvic floor tension, which is a bit of an interesting.
Here we are again.
Yeah. It's one of those ones funny. I just kind of see in the clinic, especially when I find someone who's, maybe in their 40s, 50s, coming in with pelvic health issues who haven't had children. More often than not, it's a tension related thing, tight pelvic floor, hypertonic pelvic floor.
Yeah. What about those who've had, again, I feel like this is just me, you and I having a conversation about my pelvic health. So thank you. I had a hysterectomy. We have other types of abdominal surgeries. Does that affect the pelvic floor? And if so, how? We could just use hysterectomy. We don't have to go through every single one of the.
So hysterectomy, we have the hormonal impact. So obviously, as soon as you have a hysterectomy, do you still have?
I kept my ovaries.
So we still have a wee bit there. In terms of a hysterectomy, what would concern me more is protecting the area. Women who have a hysterectomy are at quite a higher risk in comparison to other surgeries of the surgery failing in terms of pelvic organ prolapse and in terms of something called a vault prolapse. I'm sure you've heard of that. Okay, so imagine you've had a hysterectomy. So there used to be your vaginal canal and then your cervix and your uterus.
Right.
Now imagine your vaginal canal is like a sock. So it's tied at the top.
And they
and then
create the cuff. Right.
Yeah, exactly. So if that fails, that sock can come down. And that's something called a vault prolapse. So for someone like yourself, we're thinking in terms of we have to have a really robust, strong pelvic floor to really support that area. We have to have very good pressure kind of regulating mechanisms in terms of, for example, how you breathe during exercise, how you manage pressure in your abdomen so that you don't put extra pressure down onto the pelvic floor, and extra pressure that could put you at a higher risk of prolapse.
Wow, that's so fascinating. I had never heard of that. I heard that, while they're in there, they may nick your bladder and you need a mesh and things like of that nature. But no one ever said that to me. Right. I will say, however, prior to my surgery, so this is 7 years ago, I made sure in my own way as a personal trainer to focus on my core. So back muscles, right? Yeah. My upper abs, my obliques, because I knew my lower abdomen was going to be weak. My glutes, I for months beforehand. And I've done this with other clients. And I'm very lucky because I was up and walking within, I would say, I think I walked 3 times before the doctor came back to do her rounds. So much so she let me go home. She's like, I don't need to see her. She can go home. And I was very thankful to have had that time to strengthen everything around my, where the surgery was going to be. But that is just mind-blowing. And
it's fantastic you did that, because another thing people don't realize is the fascial connections between your pelvic floor and the muscles around it. The pelvic floor doesn't just sit in its own little puddles where it just works in isolation. There's a lot of fascia throughout your body, a lot of muscle connections. So having really strong glutes, a really strong core really helps your pelvic floor function.
Love it. Love it. I have so many questions. I'm going to ask one more because I'm going to ask two more technically.
Okay.
What about, so when I'm looking at a lot of clients and they're
Hmm.
what we call upper ab grippers, right? So they
Hmm.
have like what looks like, two abs, and then
Yeah.
they always talk about this pooch, right? This pooch in your
Hmm.
bellies. Can you discuss what like upper ab gripping is and like, as we get older, how that may get worse, if that's a thing?
So the two ways I really notice it is women who don't breathe diaphragmatically.
Mm,
They breathe up here.
yeah, in their
So
chest.
this middle area is always tense. And the diaphragm, muscle like any other, if you're not stretching that muscle, it does lose its extensibility. So you
Mm,
end up really tight in here. A lot of women talk about that sort of bra line pain,
hmm.
quite often associated with that.
Interesting.
And then the other one is women who hold their tummies in, which again, big issue. Women
I'm
who
so
hold their
glad you said
yeah,
that.
big issue because one, you can't breathe properly if you're always holding your tummy in. And again, I talk a lot about the pressure regulation mechanism. If you're holding your tummy in, so it can't expand, where does the pressure go? Down.
Mhm.
Pressure goes down, pelvic organs, pelvic floor.
Press down. Wow. I'm so happy you said that. So everyone listening, just let it out. Let's all let it out.
Yeah, let it
Just let
go.
that belly out.
Yeah.
It's funny. I went to this women's lifting club with
Mhm.
a pretty famous trainer, Jen Winderstrom. And as I'm watching her lift, this woman is fit as all can be, but in a
Mhm.
very healthy way. Not the fit you
Yeah.
see on social media where they're like, pulling up the shirt, showing the abs, but I mean, she's
Yeah.
strong. And to see her, I mean, when she's lifting, her belly is out. And again,
Yeah.
very fit woman, but it
Yeah.
is extended.
Yeah.
And, her breathing patterns were so spot on. And I was just like,
Yeah.
I wish every woman could see this right now.
Completely. Do
Right.
you know that is the first thing I generally, once I start a physical examination on a patient with pelvic floor dysfunction, the very first thing I assess is their breathing.
I love
Literally
that.
start from the top and go all the way down. Yeah.
Hmm. Amazing. Amazing. So, for listeners struggling right now,
Yeah.
what would you say is the first step they can take in improving their pelvic health?
First thing I want to say is if you are having any sort of problems, so if you are symptomatic, don't ignore them. Please go and see a pelvic health physiotherapist or whatever practitioner you prefer. That's my first kind of point. Second thing is, like we know, I like to take an holistic approach to things. So do look at the exercise, look at the diet, look at the mental well-being. So once we've kind of taken care of everything in the background, I do have a few things specific to the pelvic area that I like to advise people on. And the first thing is good vaginal hygiene, which ironically means not really washing your vagina. As I said previously, your vagina is self-cleaning. We have the mucus it releases, we have the slightly acidic pH that takes care of all of that for you. So in terms of washing, lukewarm water is absolutely enough.
Mhm.
If you are a little bit on the dry side, you can wash with an emollient, and that will just give you like an extra barrier of moisture and that sort of stuff. Another thing is something that can really be your friend is vaginal moisturizers. They
Mm.
really help in terms of the dryness and
Mhm.
the loss of elasticity, all that sort of stuff. And kind of while we're on that topic, lubricant.
Right.
A woman in perimenopause should have lubricant in terms of sexual intercourse, makes everything so much easier, more
Right.
pleasurable, just, stops that whole cycle we were talking about
Mhm.
earlier.
Quick
The
question on
next,
that.
yes, go.
Water-based lubricants are the
I,
best, or does
you
it?
can use water-based and oil-based. I generally find as long as it's something quite natural, and when I say natural, I mean something that's not scented, something that's not flavored. You just want to use something that's kind of kind to the area.
That makes
Obviously,
sense.
if you're using condoms for protection, then yes, definitely water-based.
Gotcha.
The next, I am a big fan of vaginal estrogen. Massive fan of vaginal estrogen. It can make such a difference in terms of, I always use this analogy that imagine your vagina and your pelvic organs are like a flower, and you haven't watered that flower in ages. And it's all sad and drooped over and it's all fragile. And putting vaginal estrogen into that area is like watering that plant. It increases the thickness of the tissues, the plumpness, the elasticity, the blood flow, the fluid secretion. It's fantastic. And the great thing about vaginal estrogen is it's only locally absorbed. There's a tiny, tiny bit that gets absorbed into your system, but it's mainly locally absorbed, and it's a really, really low dose. So even women who've had, estrogen receptive breast cancer, etc., that can't take systemic HRT can take vaginal estrogen, and it makes a massive difference to so many women.
I love that.
Yeah. And then the last thing is your pelvic floor exercises. And again, we touched on this earlier, knowing how to do them and then doing them. It's a muscle like any other, your pelvic floor. So it does need exercise, but it needs exercise the right way.
Yes, I love it. Thank you. Thank you. Last question. You have a pelvic floor masterclass. Correct?
I do.
Tell us about that. I want you to tell people where they can find it and where they can find you.
Yeah. So the main reason I did the masterclass was because, and I'm not kidding, about 95% of the women that I examine do pelvic floor exercises the wrong way.
Again, ding, ding, ding.
So that was a big motivation in doing the course. I wanted women to understand how to do them so that when they were doing them at home, I know at least they were doing them the right way and making progress. So I don't know what the system is like in the States, but over here, you have a baby. There's no postnatal care in terms of physiotherapy or anything like that. You have a midwife that comes around and goes, now remember to do your pelvic floors. And that's it. Right, so women don't know what they're doing. So that was one of my big motivators. And the other thing was, being in a clinic in Northern Ireland, you can only reach so many people. So the only way really to reach more was to put it in a course and put it online. So it's a 12-week guide of structured pelvic floor exercises, taking you from week 1, which is just how to do a pelvic floor exercise, the coordination, the breathing, all that sort of stuff, and then just slowly building it up week by week and incorporating it with whole body exercise to kind of give your pelvic floor a bit of a shortcut to strength. Put it that way.
Sign me up. I will do it.
Yeah, you can find it on my website, which is chantallowryphysio.com. And on Instagram, I am at Chantal Lowry Physio, I believe.
I think so. We will link it. So you don't even worry about that, girlfriend. Good. I know. Sometimes I'm like, is it the mindset of matter? Is it mindset of matter? I don't remember, but we'll link it. That's the beautiful thing. Awesome. This has been so informative. You think but this is why you're an expert. And I hope everyone listening was taking notes. And, for those of you who are local to where I am, we have a provider in the Valley here, but also we have, Chantal's masterclass. So please, please, please take advantage of that. If you have not already, make sure you have hit that follow or subscribe button wherever you're looking or hearing you're seeing our beautiful faces and hearing our beautiful voices. And of course, if you're listening to this and you and your girl chat of moms have been complaining about a little bit of incontinence or dryness or whatever that is, why don't we just share this in the group chat? I would love for you to do that. And as always, we're going to leave you the same way we do every single week, reminding you that what you say in your mind, you see in the mirror. Bye-bye.